Welcome to The Breakdown with Dr. Earl, a mental health podcast. This is Dr. Earl Turner, a licensed psychologist and psychology professor in Texas. Just a few disclaimers. The Breakdown podcast is not intended to replace working with a licensed mental health professional. The podcast is only intended to provide educational information and discuss psychology as it applies to your daily life. All right, welcome to The Breakdown. This is Dr. Earl, and today I have joining me Dr. Kevin Chapman. Today's episode is about coping with anxiety, and I know that that's your specialty area, and so I'm excited to have you on to talk about that. And so just tell the audience a little bit about some of the work that you're doing. I know you do a bunch of different things related to anxiety disorders.
Yeah, so I think overall, ultimately my research background's always been in what we call the family transmission of anxiety. So I've always been interested in studying anxiety, so how anxiety is transmitted from parent to child. And I've done that historically across racial and ethnic groups, so comparing, say, African-American families to non-Hispanic white families, and basically examining different anxiety disorders across different groups of people. And then ultimately that translates now, of course, into how do you treat anxiety. And so we break things down like panic disorder, social anxiety disorder, even OCD, phobias, things along those lines, worry. So basically studying how anxiety is transmitted from parent to child, and then of course how that translates into treatment, because more people have anxiety disorders than anything else in the United States. So being able to effectively provide time-limited treatment that's effective and supported by research is really the bottom line of what I do primarily on a day-to-day basis.
Okay, great. Yeah, I mean, I think you mentioned a good point about it being a very common sort of disorder, but I think one of the things that I often talk about is that anxiety in general, like there's some levels of it that is adaptive and helps us to sort of function, but then it sort of crosses over into that threshold where, okay, this is now sort of to be problematic, and it's impacting my sort of performance in a number of different areas. And working with kids, a lot of times, it impacts their school performance sometimes. And so I think it's important to sort of recognize sort of what that looks like, what might be involved in the treatment process. And so we can sort of talk about that for a little bit. So in terms of sort of your expertise, can you give the audience just a couple of like pointers about when we talk about anxiety, like what does that look like in terms of sort of crossing over into, I guess, that clinical threshold when it starts to impact your day-to-day life?
Yeah, Dr. Earl, your point well taken about anxiety really is an adaptive emotional experience at the end of the day, because it's one of those things that we all have. It's just a matter, as you said, is whether or not it, starts impairing functioning and things along those lines, because ultimately anxiety is helpful. It helps us prepare for what we call, future threat, or what we also call preparatory coping. In other words, anxiety, if you put it into words, would say, Dr. Earl, I don't know if this event's going to happen again or not, but I have to be prepared for it just in case. So anxiety really is trying to prepare you to problem solve effectively for a potential event situation, whether it be giving a speech, meeting someone new, or some sort of demand that you might have. So that's actually helpful and healthy, because anxiety is rarely a problem unless it's chronic. So when it crosses over into it like dominating my day-to-day experience, when it prevents me from doing things that I enjoy, whether it be interacting with family, whether it be meeting demands of my job, whether it be, going and engaging in a social activity that I normally would like to do, but I don't, I feel so uncomfortable doing it, that's when it starts becoming a problem. So when anxiety impairs my functioning in either work, school, relationships, and prevents me from accomplishing like personal tasks and goals, then that's when it really crosses over into more of a clinical threshold.
Yeah. That anxiety specifically does impact your performance. So there's that sort of good anxiety that might sort of help you prepare for that situation. Then there's that more, we can say bad anxiety that can hinder you. So talk with me a little bit about sort of how can anxiety be good for you in terms of performance, either in sports or other areas, and then how can it be maybe negative or not as good?
Yeah, that's a great question. So I think in terms of anxiety in any sort of situation, whether it be performance in sports specifically, like you said, I was a college athlete, but also I do sports performance enhancement as a sports psychologist as well. And I think that it's a very important distinction, because when you think about anxiety and other strong emotions like excitement, you know, you don't really see people in treatment for being too excited about things, right? Like, but if you think about anxiety, excitement, even fear or anger, ultimately all those emotions have the same physiological arousal associated with them. The difference, though, is often our interpretation of that arousal. So in some sense, what we find is, like, when I played football, particularly my college coach and my high school coaches used to say, if you ain't hype, something ain't right. In other words, if you are too relaxed going into a sports specific situation, you're not going to be able to get it up, right? To be able to, you know, shake somebody on the football field or to perform the way you can, because your body's too relaxed. But if you're hyper aroused by saying the things to yourself like, oh, they're going to blow us out. Oh, what if I screw up? What if coach pulls me out of the game? Then my heart rate's going to be way too high and make me tight, which is not good in any sport, and therefore inhibit my performance. So there's this optimal level of arousal, Dr. Earl, in the middle.